everyone. In this opportunity, we would like to present our student project about Trichinella Spiralis. First of all, before we start our presentation, we would like to give our gratitude to the Almighty God so that we could finish our student project. We also would like to thank our facilitator, Dr. Igusti Ayusri Darmayani, Specialist of Obstetrics and Gynecology, Master of Medical Education, that has guided us in making this project, and also our evaluator, Dr. Ruh Ariwati, that will kindly assess our student project. So, without further ado, we will start our presentation. This student project is titled Trichinella Spiralis, and this project was arranged by SGD B6, which consists of the members mentioned below: Amandeus, Fernandito, Leksana, Yukta, Iswari, Trifena Lisanias, Celine, Aurelia, Ahmad, Jansen Jayadi, Anak, Agung, Istri, Kosalya, Arini, Viona Mareska, Krishna, Putra, Pramanda, Sherly, Septiana, Chandra, Wayan, Mahatma, Amara, Pawana, and Justin, Lordia Lin. In this presentation, we would like to talk about the introduction, which consists of the background, statement of the problems, purpose of the study, and also the benefits of the study. Second one is content, which consists of general overview of Trichinella Spiralis, the epidemiology and geographical distribution, life cycle, pathogenic effects and symptoms, diagnosis, treatment, prophylaxis, and also the conclusions of our student project. So let's begin with the background that will be presented by my friend.
My name is Justin. I'm going to explain a bit about Trichinella spiralis. Trichinella spiralis is one of nematode parasites that is responsible for the disease trichinosis. Infections by Trichinella spiralis are obtained by eating uncooked mussels containing the encysted larva from infected animals, mostly pigs. Infection by Trichinella spiralis creates an immunological environment inside the host that is not fitting for the development of inflammatory disorders, such as autoimmune diseases. Trichinosis has symptoms such as fever, diarrhea, headache, myalgia, and facial edema. Neurologic diseases can also occur if the larva migrates to central nervous system. This can cause diffuse lesions, blood vessel obstruction, directing to infection and the production of inflammatory exudates. As you can see, trichinosis mortality is 17%. Next, here's some statement of the problems. What is Trichinella spiralis? How can it be transmitted and infect humans? How are the life cycle of Trichinella spiralis? How to diagnose Trichinella spiralis infection, and what are the treatments? How to prevent Trichinella spiralis infections? Next.
Now I will continue the presentation. I will talk about the purpose of the study. The first one is to acknowledge what is Trichinella spiralis. Second, to acknowledge how is the transmission of Trichinella spiralis to human's body. Third, to acknowledge the life cycle of the Trichinella spiralis. Fourth, to learn how to diagnose and treat patients with Trichinella spiralis infection. And the last one is to know how to prevent Trichinella spiralis transmission. We also have benefits of the study. The first one is students are able to comprehend and explain about Trichinella spiralis and its effect on humans' health. Second, students are able to understand diagnosis and treatments to the patients with Trichinella spiralis infection. And the last one, students are able to comprehend how to prevent Trichinella spiralis transmission into humans' bodies. That's from me. Now the presentation will be continued by my friend.
Thank you. And now I'm going to continue the presentation. I will be discussing about the general overview of Trichinella spiralis. Trichinella spiralis is an intestinal and tissue nematode that can be characterized as having a length around 2 until 4 mm for female worms and 1 until 1.5 mm for males. Trichinella spiralis is well known as the cause of trichinosis, which can cause pain on movement and periorbital edema as a result of extraocular invasion by this parasite as the first symptom of this disease. The infection is acquired via ingestion of uncooked meat in the vast, and in the vast majority of instances, it is via infected pig in the form of encysted larvae. Ingested cysts are passed to the small intestine and mold into adult and form to reproduce. The female worms, their reproduced larvae, will enter the intestinal walls and circulate in the blood to be encysted in the muscle tissue. Thank you, and the next next presentation will be continued by my friend. Thank you.
I will continue the presentation about the epidemiology of Trichinella spiralis. So, as mentioned before, mainly transmission of Trichinella spiralis into human body is generated by intake of uncooked or raw meat from infected animals, in which the encysted larva of Trichinella spiralis mainly hides in the muscles of the infected animal. In spite of that, some of the reported cases have shown different transmission trend of the encysted larvae, in which meat preparing utensils such as knives, cutting boards, and others also included in possibilities of Trichinella spiralis transmission form. Trichinellosis or trichinosis, which is the term used for disease caused by Trichinella parasites, mostly Trichinella spiralis, have shown a result of decreasing number of cases in current period due to strict regulations on commercial purpose pig stock breeding, especially on feeding regulations. On the other hand, amount of annual trichinosis cases had firmly decreased, reaching the number of 20 only up from 2008 until 2010. However, eating raw or undercooked meat is still maintained as a habit by some civilians. As well, in Asian region, China is known as the country with highest rate of trichinosis case that region, as well in worldwide rate of cases. That's all for me. The presentation will be continued by my friend Krishna.
Thank you for the chance, Dito. So today I would like to continue this presentation about the geographical distribution of Trichinella spiralis. The geographical distribution of Trichinella spiralis have been described by Poggio that T. spiralis is found mainly in the domestic habitat where environmental stress is limited and its high reproductive ability has a selective advantage. T. spiralis is a widespread in the world, especially in the countries that consume pork that is not cooked properly, for example in the Europe or North America. In addition, Asia has been reported to be present in Thailand, Syria, and India. Meanwhile, in Papua New Guinea, it was about 30%. Besides, another temperate regions as New Zealand and South America is also become one of Trichinella spiralis deployment. In about 20% of countries around the world, including most small island or city-states where Trichinella spiralis infections cannot develop due to lack of reservoir potential, and the number of cases are very low because the infection of the human only accidentally occur when import legal or illegal meat infected by Trichinella spiralis from abroad. That's all from me. This presentation will be continued by my friends Jansen. Thank you.
Thank you for the chance. Now I would like to continue about the life cycle. The life cycle of Trichinella spiralis divided into enteric phase and parenteric or systemic phase. The life cycle of Trichinella spiralis begins while a person consumes the contaminated meat containing the encysted larva. While the larva enter the stomach, pepsin and hydrochloric acid secreted by the stomach dissolve the capsule-like cyst and release the first egg larva, which pass into the small intestine. In the small intestine, Trichinella spiralis invade the columnar epithelium of the small intestine. The female worms can produce newborn larvae during lifespan before the expulsion by the host immune system. Larva production completes the enteric phase. After that, parenteric phase started. The migratory phase of infection of the Trichinella spiralis begins when these newborn larvae are passed into tissue, enter lymphatic system, and then enter the general circulation or into thoracic duct. These larvae spread widely in the tissue through the circulation system and eventually make their way through the capillaries into the muscle fibers, which initiates the muscle phase of infection. That's about the life cycle. My friend will continue the presentation.
Thank you for the chance, Jansen. Now I will continue the presentation. I will explain about the Trichinella spiralis pathogenic effect and symptoms it may resolve. When the meat contaminated by the encysted larva of T. spiralis are consumed by human, or will be digested by digestive acid and protease, liberating the larva inside. The larva will then infect the small intestine and proceed to grow to mature and mate, producing more larvae in the small intestine. The female Trichinella worms will release the larva that will enter the striated muscle and furthermore into the brain via circulation, and then proceed to insist in the high oxygenated tissues. Next, and now its symptoms. On the first 2 days after consuming a high portion of the contaminated meat, symptoms such as nausea, diarrhea, abdominal cramps, and slight fever will begin to show. During the larva infection to the muscle, on the 7th to 15th day, symptoms such as muscle pain, weakness, fever, headache, and swelling on the eye and face may show. The most involved muscle groups to be invaded, places where symptoms will most likely show, are muscles of jaw, lower back, neck, and diaphragm, sometimes resulting in difficulty in breathing. The migrating larva will provoke hypersensitivity, inducing fever and hypereosinophilia. That's all for me. Now the presentation will be continued by my friend Viona.
Thank you for the opportunity. Now I would like to continue the presentation by taking it to the diagnosis. Now trichinosis is an infection caused by a Trichinella spiralis. However, diagnosing trichinosis in its early stage is somewhat difficult. Physicians or healthcare workers from non-endemic regions usually lack the information and familiarity regarding this disease. The diagnosis of trichinosis can be started with doing a simple anamnesis to the patient. This is where healthcare worker will ask questions about the patient, most commonly where he or she has been in the past few days, how he or she eats, and many others. Afterwards, the physician will then take it to the lab. When a patient is suffering from a Trichinella infection, leukocytosis along with eosinophilia are common to be found because the increasing white blood count caused by eosinophilia is commonly increasing, and during the acute stage, eosinophil levels will plummet down, and abnormal levels of muscle enzymes such as creatine, phosphokinase in the blood. During the acute stage, infection levels of immunoglobulin E or IgE in the blood serum are commonly increasing. Afterwards, a muscle biopsy to detect the ingested Trichinella spinalis larvae can be found, and lastly, serologically, this disease can be diagnosed by using the ELISA assay or the ELISA method. It is able to detect anti-Trichinella immunoglobulin G or IgG in humans during the infection. That is all from me to diagnose a Trichinella infection. The presentation will be continued by my friend.
Thank you for the explanation, Fiona. Now I'm going to explain about the treatment of trichinosis. Trichinosis infection treatment has to be conducted as soon as possible after diagnosis. The treatment includes stopping the progression of trichinosis, which can grow adults and produce larvae in muscle. Anthelmintic drugs are the gold standard for the treatment of trichinosis, which include albendazole primarily and mebendazole. Protein and electrolyte is also needed for the deficit that might come after therapy. Dose of albendazole recommended for trichinosis is twice daily for 8 to 14 days, 400 mg each consumption, while for mebendazole is 3 times a day for 3 days, 200 to 400 mg each consumption, followed by 3 times a day for 10 days, 400 to 500 mg. However, the use of mebendazole and albendazole are only suitable for adults and children above 2, and they are contraindicated during pregnancy. Instead of albendazole, pyrantel is more safe to be used by children and pregnant women. The presentation will be continued by my friend. Thank you.
Thank you for the opportunities given to me. Now I would like to explain about prophylaxis. It is better to prevent the causes of a disease than to cure it. Prophylaxis itself mentioned how to obstruct the source of sickness. Trichinella spiralis is a nematode that causes trichinosis or trichinosis. So this type could bring negative reactions to our body, such as abdominal pain and muscle pain. Avoiding Trichinella spiralis is related to our food quality. Food quality in this context is more likely about cooked food, so it is safe to be eaten. When we eat meat with Trichinella spiralis larva without good cooking temperature, it will cause the parasite to enter our gastrointestinal tract easily and grow by taking advantage of our body. There are two basic ways to limit the spreading of Trichinella spiralis. The first one is by preventing the parasite from getting into the animal's body that we often consume. Pigs' livestock should have good sanitation and also provide routine blood testing for animals. If there's a chance that a pig is being infected by T. spiralis, we need to understand that drying meats without specific temperature regulation is not going to kill the parasite larva. US Code Federal Regulation promotes meat processing by heating it to 58 degrees Celsius. The other crucial prevention is by avoiding the parasite from being transferred to human's body. We have to wash our hands with soap and running water after touching raw meats to stop contaminating other stuff or foods with germs, parasite from the meats, especially pork. I think that's all that I could share to you. The presentation will be continued by my friend. Thank you.
Okay, now I will continue the presentation. This is our summary. Trichinella spiralis is an intestinal and tissue nematode that is well known as the cause of trichinosis. This nematode is widespread in the world, and especially in the countries where the majority of the country is consuming pork. The life cycle of Trichinella spiralis is divided into two phases that are the enteric phase and the parenteric phase. The enteric phase is the phase when the larvae of the Trichinella spiralis entering the host by ingestion of the food that is contaminated, and the parenteric phase is the phase where the Trichinella spiralis start to invade and infect the host. The symptoms that can occur by the infection of Trichinella spiralis are myositis, myalgias, periorbital edema, and hypereosinophilia, and sometimes followed by tachyarrhythmia. And for the worst case, the trichinosis can result in encephalitis and pneumonitis. The diagnosis of Trichinella spiralis infection can be based on the laboratory examination test. The gold standard of the diagnosis of the trichinosis is by feces examination. The infection of Trichinella spiralis can be treated by several drugs, such as anthelmintics and glucocorticosteroids. But the gold standard drug for the treatment of this infection is anthelmintic. The infection of Trichinella spiralis could be prevented by washing our hands properly after touching raw meat or animals that are likely to be the reservoir of the nematodes. Fully cook the meat before eating to kill the larvae, so the larvae cannot live in our body. That's from me. Now the presentation will be continued by my friend. Thank you.
So that's all from our presentation. We would like to apologize if there are any mistakes, whether it is unintended or intended, that we made in this presentation and student project. So thank you for the attention and see you next time.